Welcome to the Community Health Heroes Show, where we spotlight local organizations that provide much needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Ann K. Lagarbo, Chief Medical Officer for United Healthcare Community Plan of Louisiana, and I'm filling in today for Dr. Penny Walker. Today on Community Health Heroes, we'll be speaking with Mike Griffin, CEO and President of Daughters of Charity Services in New Orleans. We will talk about the importance of health equity for all racial and ethnic minorities in our community. And in recognition of Eye Wellness Month, Dr. David Kennedy, an ophthalmologist with Gulf South Eye Associates and a member of the Jefferson Parish Medical Society, will be here to talk about eye wellness and how you can protect your vision. And in the Eat Fit NOLA cooking segment, we'll be in the kitchen with Kenneth Temple, owner and chef of Savory, a meal delivery and personal chef service. So don't go away. We'll be right back with more Community Health Heroes.
How do we show our gratitude for our active duty military and veterans? The Disposable Heroes Project is a nonprofit organization serving all branches of the military and their families. Their mission is to recognize, honor, and support our veteran and active duty personnel in any form of assistance they may need. Visit dhproject.org now and donate or purchase merchandise to show your support. dhproject.org. It's your turn to serve.
Welcome to Community Health Heroes. April is National Minority Health Month. Minorities, especially African Americans, continue to visit their doctors in far less numbers than whites in our community. Joining us today to talk about these health disparities and how everyone in our community should have access to health care is Michael Griffin, CEO and President of Daughters of Charity Services in New Orleans. Thank you, Mike, for joining us today. So Mike, we know that April is Minority Health Month. Can you tell us, when we talk about health disparities, what we mean by health disparities?
Well, health disparities is the preventable difference in the burden of disease. Also includes things like violence and other areas of health that actually can be prevented or actually avoided over time through getting some type of treatment or lifestyle or activities from individuals. And so disproportionately, minorities have had worse outcomes for health disparities than majority communities. That's been probably more so because of things we call social determinants of health, which are income levels and education levels and other things that really have nothing to do with healthcare itself.
Right.
But it has all to do with your environment and the things that you are a part of your network and things that you do every day. So what you eat, your family traditions and environment, your house and household, schools, and your daily, everyday life, transportation. All of these affect your health, and what some would say is 80% of your health is determined by things that really don't have anything to do with your health, and 20% are affected by healthcare delivery itself. So educating the population on those things that affect your health can help eliminate health disparities.
And I know with Daughters of Charity, because we're very familiar with you and your organization through United Healthcare Community Plan and what great work that you do, but you all not only offer acute care for medical illnesses, but you also offer dental services, the ever important behavioral health services, because we all have a little something. And that's an important component to get the whole person cared for through clinics such as your own, correct?
Yes, and we really focus as a faith-based provider in our community, mind, body, and spirit, actually taking care of the total person and actually working with those individuals to prevent health and different stages of disease, but also educating patients on the chronic conditions that they do have. We have quite a few diabetics, and we've actually ventured in a program focused on pre-diabetics, really getting people who are on the cusp of becoming a diabetic, educating them on how they can change their lifestyles, physical activity, diets, other areas to prevent becoming a diabetic. That's very important. We also have pharmacy services, and we have medical therapy and other aspects of health, really understanding how the treatments that you have, but also the medications that you have can affect your health outcomes.
How can we give, particularly the minority population, since we're talking about this month, how can we give them advice, tips on to know when to go to your clinic like Daughters of Charity and when to go straight to the emergency room? Because we know about emergency room utilization in Louisiana and how we have to do better with giving the right care in the right place. Any tips for people out there as to?
Well, we always stress having actual well visits and understanding where you are in your health status is key. So knowing your body, knowing what chronic conditions you may have, what disease states you may have, having an annual well visit exam is very, very important. So we stress that. That means no, you're not sick, no, you don't have the cold or flu, but you go to the doctor and you give your health history. So many things are determined by your background, your family's history of heart disease or chronic conditions, and they may be genetic. So your doctor understanding your history and background, educating us on what things we need to do to not have those same conditions, but having that type of engagement early on with your provider is important. And then some studies have shown upwards of 80% of patients who go to the emergency room really could be treated in a primary care setting.
And treated better in a primary care setting.
Treated better in it, more
with your doctor, who knows you.
And so with your doctor that knows you, with other services that you could engage, not even the physician or the nurse practitioner, but a nurse care manager, social worker, others that will, and we call those care extenders, others that will help you learn more about your conditions. They're all there and all available to again, work with individuals to educate them and help to change their health status. So it's very important to engage with your provider, even though you may not be sick or what have you, and do that early. Don't wait until what we call a train wreck, where you end up in the hospital with chest pains. And if you have chest pains, go to that emergency room.
Of course.
If learning and educating yourself, and we can teach those who are predisposed to things like those are higher risk, I guess you would say, for stroke or something of that. And they know the signs. There used to be a campaign we used to have when I was in another market that was Know the Signs, Act in Time for stroke. And so knowing those are very important, and you do get those type of educational tips at your primary care doctor's office. So that's very, very important.
Mike, I cannot thank you enough for joining us and sharing this really important information, and for everything that you and your entire team at Daughters of Charity do for our community. And we're very happy that you've had us here. We are in this New Orleans market and all over the community with 9 locations, and we're very excited about the future of healthcare in our community and being able to change the health status. Absolutely. Thank you. When we return, we'll be speaking with Dr. David Kennedy of Gulf South Eye Associates. So don't go away. We'll be right back with more Community Health Heroes.
Packers.
Vikings.
Red State. Blue State.
We come from different places.
Uptown.
But when we live united, we create real lasting change in the education, income, and health of our country.
United.
Real change won't happen without you. So give, advocate, volunteer, Live United. Sign up at liveunited.org.
Welcome back to Community Health Heroes. Did you know that the human eye only sees 3 colors? Red, green, and blue. All the other colors are the combination of these. Joining us today to talk about eye wellness is Dr. David Kennedy, ophthalmologist with Gulf South Eye Associates and a member of the Jefferson Parish Medical Society. Welcome to the show, Dr. Kennedy, and thank you for joining us.
Thank you, Dr. LaGarbo. It's nice to be here.
Tell us about vision screenings, how important they are, how often we should have them.
So, vision screenings are very important. For adults, I recommend a screening once annually.
Okay.
For children, healthy children, I would recommend screening every 2 to 3 years.
Okay.
So for adults, it's important to screen because you can detect diseases like cataracts, glaucoma, or diabetic retinopathy in the early stages. If you catch these problems in the early stages, many times you can treat them and prevent, severe or permanent vision loss.
Mm-hmm.
In children, the most serious thing can be a misalignment of the eyes or an imbalance between the 2 eyes that usually can be treated with glasses. However, if it's left untreated, then usually the worst seeing eye can experience permanent vision loss that
Wow.
just cannot be fixed. I said that's the worst thing. It's not the worst thing, but it's the most common thing.
Sure. So ophthalmology, I'm sure, has changed as our focus on certain things have changed. And, growing up, the most strain I had was watching the TV.
Mm-hmm.
Well, now, of course, everybody's looking at a computer screen all the time, and many of us work staring at a computer screen. Can you tell us about eye strain from looking at digital images all the time?
Mm-hmm. So when patients frequently complain about eye strain. When I hear that, I think discomfort.
Mm-hmm.
So some things you can do. One, make sure you have the proper eyewear. You have the proper correction.
Mm-hmm.
So if you've had, 1 too many birthdays, reading glasses can help a lot.
Mm-hmm.
And if that doesn't do the trick, it's a good idea to see your eye care professional.
Mm-hmm.
Maybe they can help out with giving you a prescription pair of glasses. The next thing is that many people will come in and they tell me they have a headache, but they've been reading for 3, 4, 5 hours straight.
Mm-hmm.
So it's important to take breaks. A good rule of thumb is about 45 minutes to an hour.
Okay.
It's good to not only take a break for that, but to get up, walk around, get the blood flowing and everything.
Is it true that watching 3D movies can actually detect certain visual problems people may be experiencing?
So 3D technology is very cool. It's certainly enjoyable, and some people have suggested that it can detect eye problems.
Mm-hmm.
The first thing I want to emphasize is that just because you're able to enjoy a 3D movie and everything seems to be functioning properly,
Mm-hmm.
that is in no way a substitute for a proper eye exam.
Sure.
However, some things to look for if you are worried about your 3D movie experience would be, first, if you're not enjoying the 3D, if it doesn't seem to be working, if you don't seem to be appreciating that 3D effect, there
Okay.
could be a problem with the alignment of your eyes or with the power of each eye.
That's interesting.
The second thing is if you're experiencing double vision, along the same lines, your eyes may not be working together. And so that would be another reason to see your eye doctor. The last thing was if people experience nausea or dizziness, try taking your glasses off first, see if that doesn't resolve the problem. If you keep experiencing that, I would go see someone.
Interesting. Let's talk about injuries. As a pediatrician, we were always very cognizant of injuries. Are injuries to the eye more common in men, more common in women, workforce, and in the sports world? Can you talk to us about that?
Of course. So they're by far much more common in men.
Really?
It's
Okay.
about 3 or 4 to 1, men versus women. Some of the reasons for this are probably kind of how you said. Young males, tend to get a little bit more rough.
Mm-hmm.
Young males tend to be the ones that are fighting more. That can be an issue. Sports-related injuries, certainly women have sports-related eye injuries as well, but they seem to be more common in men.
Mm-hmm.
And then in the workforce, men tend to have jobs more like construction, vocational jobs that, they may be at high risk for either a chemical spill or a projectile or a foreign body getting into their eye.
Okay. What about protection, eyewear protection, particularly in sports? I know kids don't like to wear them, but let's talk about the importance of that.
So eye protection is very important, especially for someone that may have one eye. Very
Right.
important to protect the other eye.
Right.
So the most important thing with eye protection is to consider the type of plastic that's being used. It should be something called polycarbonate lens. What this is it's a special type of plastic that's shatterproof. So it just provides a really good barrier between you and whatever it is that you're doing. So for children, I would recommend a goggle type device because it has a tight, elastic band in the back that can keep it in place during sports or other activities. Adults can usually get by with glasses that are, as long as they're polycarbonate lenses. Usually a drawstring is a good idea in the back, just to prevent it from sliding around and everything.
So can you tell us where people can get information about caring for their eyesight? Any particular sites they can go to find out more information?
Of course. So our website, it's www.gulfsoutheye, provides a lot of useful information.
Wonderful.
The American Academy of Ophthalmology also provides a lot of useful information, and their website is www.aao.org/eye, that's EYE -health.
Wonderful. Thank you so much for being with us and sharing this really incredible information for all of our viewers.
Thank you.
When we return, we'll be speaking with Kenneth Temple, owner and personal chef of Savory, a meal delivery and personal chef service, when they join us in the kitchen for another exciting Eat Fit NOLA cooking segment. So don't go away. We'll be right back with more Community Health Heroes.
I'm Molly Kimball, registered dietitian with Oxnard's Elmwood Fitness Center. We've collaborated with more than 60 local restaurants to create Eat Fit NOLA, a partnership that highlights the better-for-you items right there on a restaurant's menu, making it effortless for you to dine at your favorite New Orleans restaurant without ditching your otherwise healthy diet. Every month, the Community Health Heroes Show will shine a spotlight on one of our city's incredible chefs who will show you how you can make healthier choices when dining at theirs or any of our city's great restaurants. So don't go away. Community Health Heroes will be right back.
When you have a hole in your neck, don't face the shower head.
Suction out your tube before you eat.
Crouch. Don't bend over. You don't want to lose the food in your stomach. Don't use spray paint.
Be very careful shaving.
Welcome back. Joining us today for the Eat Fit NOLA cooking segment is Kenneth Temple, owner of Savory, a meal delivery and personal chef service that makes traditionally indulgent dishes more nutritious. Thank you so much for joining us today, Chef.
Thank you for having me, Doc.
Absolutely. So first of all, what are you going to prepare for us here today?
I'm going to make a beef and broccoli stir fry.
Oh, wonderful.
You know, a great thing about doing the meal prep delivery service is putting different little flavor ingredients that we're used to seeing in the grocery store, but not knowing exactly the benefits that it brings to the body.
Wonderful.
Ginger, for instance, is anti-inflammatory, and it helps with muscle soreness. So this would be a great meal after a hard day or a post-workout meal.
Wonderful. Well, I'll let you get started and we'll chat.
All right.
How long have you been affiliated or partnered with Eat Fit NOLA?
About maybe a year strong. I was working on a cooking show called Flip My Food, and I actually met Molly while it was on there, and I thought what they was doing was pretty cool, especially with me being a chef and working with NBA and NFL guys and making their lives a whole lot healthier. I thought there would be a pretty good relationship to build, and I always wanted to do a little bit more for the community. You know, you're working with private clients, but you can't really broaden your horizon to everyday people. So that's what this was for. That's why I created the Savory Meals, so we can have this beautiful things that I cook for my athletes and bring it to everybody else.
The ginger smells divine.
You smell it
I
already?
wish I could smell it. It smells absolutely divine.
So we have a little bit of light soy sauce in here, a little bit of ginger. We're gonna add some garlic. Everybody likes garlic, right? A little bit of lime juice, some red crushed pepper flakes, a little bit of heat. We're gonna add some unsalted chicken stock.
Okay.
Now, according to the Eat Fit NOLA diet, I'm not allowed to just dose everybody with soy sauce because of the sodium levels.
Right.
So we add a little unsalted chicken stock to boost up, you know, give a little bit more body to everything.
So how many Eat Fit NOLA items do you actually offer through your service?
I actually have the most. I have over 50 recipes
wonderful.
on Eat Fit NOLA. But I've only released 24 now, just so we can get the market knowing about me and to get used to the flavor profiles.
So you have a meal delivery service also. Tell us about that.
So the way it works is I send out 6 menus a week to my email list clients, and they pick the number of quantities that they want, however meals they want. I told them if they want 36 beef and broccoli stir fries, they can get 36 beef and broccoli stir fries. And we deliver it free of charge Sunday, Monday, and Tuesday. And we've been getting some really good results.
And do you find that more people are turning to meal delivery prepared service in order to meet the nutritional needs and to eat better?
Absolutely. It's one of the hottest things across America at the time right now. But everybody doesn't have the menu that I have. So I'm willing to go against anybody and put my meals up against it. But it's definitely very convenient. I like to call this healthy fast food. It's already in your refrigerator.
Right.
You already know it's healthy. All you have to do is decide what you want to eat. Like right here, I have a shrimp stir fry.
It looks delicious.
And then right here, I have a barbecue turkey meatball with grilled zucchini and roasted peppers.
And so is that how they come?
This
come
is
like
exactly
this?
how they come. Nice and packaged, they're microwavable containers, and all you have to do is just pop it in the microwave for 2 to 3 minutes.
Wonderful.
And voila.
Wonderful. What are some of your favorite items that are Eat Fit NOLA certified?
Eat Fit NOLA, I'm a little biased to my menu because it's so broad. I have pesto shrimp, barbecue salmon, I have mahi-mahi tacos, I have beef and broccoli
Oh my gosh.
stir fry. So I even have a shrimp creole and brown rice. I even have a shrimp scampi with lemon butter and squash. So
Now-
I have some classic New Orleans, but then also a little bit,
And did you develop some of these recipes yourself?
some.
All of them?
All of them.
Fabulous.
All of them, yes, yes. So it's just my way of having variety, because as a chef, you can get bored cooking the exact same thing, but this also helps me have fun in the kitchen, but then also allow my clients to do the same.
Wonderful.
So you can see that stir-fry sauce starting to work, and we added a little bit of cornstarch in there, and the cornstarch is just a great thickening agent. It's not the flour, so it's gluten-free, and it just works wonders.
Are a lot of your meals gluten-free?
Most of them are, yes. And if there isn't, like in this meal, we have whole wheat pasta. So of course it's not gluten-free, but for the client, we can easily switch out a nice gluten-free pasta. Especially with the rise of people being aware of their gluten allergies. There's a lot more products on the market today than there was probably 2 years ago, you know?
So tell us, do you have particular locations where people can come in and buy packaged foods, or this is all designed
delivered.
for them?
Yes, all delivered and designed. Of course, certain clients need more calories, some need less, and there's a big variety of menu items. So they can basically look at the nutritional facts and see which one benefits them the most.
And so you're talking about some of your professional clients. You do a lot of that?
Yes, and I actually just started working again with the Saints and Pelicans nutritionists. So hopefully we have some fun and have these players a lot healthier on the field.
Great.
So I just added a little bit of flank steak with a little sesame seed oil and a little olive oil. And I'm just going to add just a little pinch of salt just to bring out the natural flavors of the meat. That's allowed, right?
And this is, yeah, we're going to have a little bit of that. we are Louisianans, right? So we got to cheat just a little bit.
Absolutely.
And this is quick.
Yes, yes. It doesn't take long. It's very fun to prepare. Let's see what we can get here. Yeah, that's a nice little spoon. Can you smell the aroma?
It smells phenomenal.
I hope you trust me after I make this meal for you.
Absolutely, absolutely. We might not let you out of here after you make
That's
this
not a
meal
problem.
for
My
us.
mama's not looking for me. My girlfriend's not either, so they know I'm out working. So we're just gonna turn over the steaks and let them brown. They have a real good sear.
So tell us while you're doing that, what about your background? What other areas of cuisine have you dabbled in before you found this niche here?
Before I found the niche, well, growing up a New Orleanian, I didn't really choose to go to culinary school until my senior year in high school. So I really didn't grow up at my grandmother's stove cooking with her. My father did some baking when I was a child, so I always used to help him crack eggs and stuff in the kitchen. So I learned a lot of bit of Creole Cajun cuisine at Nicholls State University, because what's a New Orleans chef who can't make red beans and rice?
Well, exactly. Then
So-
you need to move to the north, right?
Absolutely.
Yeah.
Absolutely. So I studied that and came across it, but then I just started branching out. You know, the beautiful thing about our culture is we have African, French, Spanish, Vietnamese, Native American. There's so many different dialects and cultures that you can just pull from each one and just learn their cuisine and be surprised where those flavors actually come from.
Absolutely.
Yes, yes.
Absolutely. We are a melting pot, literally,
Absolutely.
of cuisines and cultures here, which makes us so special.
Look at this. Look at this stir fry. Huh? Nice, aromatic, quick and thick.
The ginger is phenomenal.
Absolutely. You can smell it nice and potent. I know some people who don't like ginger, but once they try this, they change their mind.
Absolutely.
So now we're going to add some broccoli. What's a beef and broccoli without the broccoli, right?
And who doesn't love broccoli, right?
Maybe like a 4-year-old, but after they try this, they'll change their mind.
So if someone, not if, when someone, after seeing this show, wants to get in touch with you, how do they go about doing that? Do you have a website?
Absolutely. They could go to chefkc.com. That's
Okay.
the letter K and the letter C.com. Tons of information on there for them to find out.
Great.
You can see the whole menu that I have laid out. And the fun thing about me being the president of the company is I can change that menu whenever I please. Like I said, I have over 50
And you don't have to
options.
get any
I don't have to
stockholder
get any
approval.
And I have over 50 menu options, so I can easily switch the menu for 4 weeks today if I want to.
So it keeps your customers from getting bored, right?
Absolutely, absolutely. And a lot of people, when they see meal preps, they're used to just chicken, tilapia, and sweet
Right.
potatoes. So
Sure.
I have this beef and broccoli, and it's just amazing what it does. And people see it and be like, "You can eat healthy like that?" I'd be like, "Absolutely,
Awesome.
absolutely."
Can't wait to see this put together real quickly.
So we're just gonna toss that up.
I've always wanted to be able to do that without making a mess of my stove.
It happens to the best of us. Don't worry. We're gonna toss that up. We're gonna add our sauce.
Oh, that is so pretty.
That's love in the skillet right there.
That is so pretty.
So, Doc, I'm going to ask you to grab this beautiful beauty plate that
Sure.
we have right down here.
Absolutely.
Just sit it right here for us. All right. See if we can
The
get
colors are just vibrant, and hopefully the viewers at home can see just how beautiful the colors are. You love what you do, huh, Chef?
Absolutely.
I could tell.
To see the power of food change someone's life
Yes.
just because it was delicious and you helped them reach the goal
Yes.
is like no other. You know, food, you touch people spiritually, physically, and mentally. So it's probably one of the only professions that you can hit somebody in all those areas, you know, in one bite.
I wish I could see how adept this man is with a knife. I'm not even scared.
That's good. That's good. Well, if you was scared, you can patch yourself up, right? Or you might end up sending me to
I was scared for you.
or you might end up sending me to the ER, right? So we're going to add a little bit of green onions.
Ready.
And then we're going to add a little bit of toasted black and white sesame seeds.
Gorgeous. Just beautiful.
So, Doc, I can't let you slide without trying some of this.
Okay, you can twist my arm.
There you go, the right arm. Twist the right arm.
Oh, it's delicious. It is absolutely delicious.
Now, aren't you glad I twisted your arm?
I'm so glad you twisted my arm. Thank you so much.
Thank you, Doc. Glad you enjoyed.
Thank you all for joining us here. This is delicious. You're very kind and your meals are fabulous. So join us next time on Community Health Heroes. Thank you so much for joining us today. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com or visit our website at www.communityhealthheroes.org. You can also find our show on YouTube. We hope that the information we provided today will help you and your family live healthier and happier lives. I'm Dr. Ann K. LaGarbo, and we'll see you next time on Community Health Heroes.